Occupied bed change with slide sheets. This patient is not able to comprehend and cooperate, or is not able to assist with weight shifting on the bed. A minimum of 2 caregivers and 2 slide sheets are required for boosting and positioning in the bed. If the patient is medically complex, additional caregivers may be required. First, the patient is rolled to one side and 2 slide sheets are placed under the patient from head to toe. One slide sheet on top of the other. Both are tucked as far under the patient as possible. The patient is returned to her back and the slide sheets are pulled through on the opposite side of the bed. To boost the patient up in the bed, the side rails at the foot of the bed are raised for safety. 2 caregivers move to the head of the bed. Standing at opposite corners, both caregivers grip the top slide sheet, roll the sheet close to the patient's shoulders, and lean back with their body weight to pull the patient up in the bed. The third caregiver may need to guide lines and tubes or support a painful lower extremity. Once the patient is up in the bed, caregivers may use the top slide sheet to slide the patient to one side of the mattress. The slide sheets are draped over the patient, and the soiled linen is removed and tucked under the patient toward the midline. One caregiver supports the slide sheets over the patient while the linen is tucked. Do not place the slide sheets over the patient's face. Clean linen is now placed on the mattress surface and tucked toward the midline under the patient. The slide sheets are placed over the clean and soiled linen, and caregivers use the top slide sheet to slide the patient over the soiled and clean linen to the opposite side of the mattress surface. The slide sheets are again draped over the patient, the soiled linen is removed, and the clean linen is pulled through. Once the linen change is complete, the patient is returned to the center of the mattress. To leave the patient on her side and remove the slide sheets, 2 caregivers support the patient's upper and lower extremities. One caregiver grips the top slide sheet close to the patient's body and leans back with his body weight to shift the patient away and onto her side. In some cases, this may take 2 small pulls. Once the patient is on her side, the caregivers will tuck the slide sheets from front to back, meaning the slide sheets are tucked under the patient and pushed away from the patient's face toward the back. While caregivers are tucking the slide sheets, they are ensuring the slide sheets are not wrapped around any peripheral lines or tubes. Once the slide sheets are tucked, the top slide sheet is draped over the patient and supported by one of the caregivers. The bottom slide sheet is removed by pulling under and away from the patient while moving toward the head of the bed. If the caregiver meets any resistance while trying to remove the slide sheet, the other caregiver may lightly pull on the slide sheet draped over the patient to assist with the removal. Once the bottom slide sheet is removed, the remaining slide sheet is removed using the same procedure. Remember, we never leave slide sheets under a patient.